In one of the previous videos, we saw about ECG standardization. Today, we will discuss about heart rate calculation when we get ECG of a patient. So just for example, this is the ECG we got in a patient. So how to calculate the heart rate, that we will discuss now. First and foremost important thing is we have to observe whether the rhythm is regular or not in the patient, because heart rate calculation will vary based on the rhythm, whether the rhythm is regular or irregular. This will matter a lot when we are calculating heart rate. So how to calculate rhythm, like how to get to know? We have to focus on the ECG paper. So by observation of the rhythm strip, we can actually get to know that rhythm is regular or not, or else we can just mark the tip of the QRS complex, right? And we have to observe the gap between these 2 points, and that gap should be maintained if it is a regular rhythm at each QRS complex tips. So here we can clearly see, suppose we mark the tips of the QRS complexes. In this one, we can see that every beat is coming at a regular interval. So this is a regular rhythm, right? With the markings on the top, we can easily make it out. Whereas in the picture on the right side, we can clearly see the gap between tips of the QRS is not regular. Sometimes it is longer, sometimes it is short. So we can mention it as irregular rhythm. So why is it important in heart rate calculation? We will focus now. First, we will focus in a patient who has regular rhythm. How to calculate heart rate? So here we can utilize 2 methods actually. First and simplest method is we will divide number 300 with the number of large boxes between 2 QRS complexes. So here if we count 1, 2, 3 and 4. So we have to divide it by number 4. So we will get approximately 75 beats per minute. This is the heart rate in this patient, right? This is one method by utilizing large boxes. One more method is we have to divide number 1500 by the number of small boxes between same again QRS complexes. So we have to count these. Suppose here if we count, it is totally 20 small boxes. So again if we divide it, it will come to 75 beats only. This is the second method using small boxes. So you might say almost both are equal only. Why there are 2 different methods? The thing is, if we want to calculate it more accurately, we have to follow small box method, because sometimes it will be overlapping, like in this case. So in that situation, it is quite not approximate to calculate based on the number of large boxes. But the thing is, to be practical, either of these 2 can be utilized. Most commonly, we will follow the first method, which is very easier one. This is for regular rhythm heart rate calculation. Now the doubt will be, what is this 300 number and 1500 number? See, when we are calculating heart rate, it is number of beats per minute, right? Per minute. So this is the basic. Per minute in the sense, for 60 seconds, how many beats are there? So here, why we are using number 300 is, suppose we multiply this number by large boxes timing. How much will be one large box? From previous class, we know that one large box account for 0.2 seconds. So it will come to 60 seconds, right? That's how we got the number of beats per minute. This is the reason to utilize number 300. Similarly, for small boxes, we are telling that we have to use the constant 1500, because if we multiply this number by the time duration of small box, that was 0.04, if you remember from last class, again it will come to 60, right? So for 60 seconds, that is to get 1 minute, we have to utilize the constant 1500. Hope you got the basic point about this. Now we will discuss how to calculate heart rate when the rhythm is not regular. Here you can follow some simple tips. For example, first calculate number of beats in 10 seconds. Okay, in 10 seconds. Then multiply it with 6, so that we will get the number of beats for 60 seconds, right? But how to calculate the number of beats in 10 seconds? From the previous class, we know that 1 second will occupy total of 5 large boxes. So now we want it for 10 seconds, right? So it will be 50 large boxes in the ECG paper. So what we have to do? We have to count the number of QRS complexes in these 50 large boxes. That will give us the number of beats for 10 seconds. You can observe it here. See here, this ECG paper has been taken for the duration of 10 seconds. So if we calculate here, the number of large boxes are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49 and 50. So overall there are 50 large boxes, giving us the number of beats in 10 seconds. So just calculate now how many QRS complexes are there. This is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 and 11. So there are total 11 beats for 10 seconds. So in 60 seconds it will be 66 beats, right? That's how we can utilize heart rate calculation when it comes to irregular rhythm. What some people will do is they will simplify it further. For example, instead of 50 large boxes accounting 10 seconds, they will do it reverse. That is, they will calculate number of beats just for 6 seconds. So it will be how much? 1 second is 5 large boxes. 6 seconds will be 30 large boxes. Then you observe how many QRS complexes are there in these 30 large boxes. That will give us 6 seconds beats. Just multiply with 10. That will give 60 seconds number of heartbeats. So the ideal method will be utilizing 10 seconds, then later multiplying it with 6. But over a period of time, or whenever we have short of time, we can just calculate QRS complexes for 6 seconds and just multiply it with 10. So that we'll get the number of heartbeats or heart rate for a minute. This is how we will calculate heart rate. Just to summarize, whenever we start calculating heart rate, first check whether the rhythm is regular or irregular. Suppose it is regular, take the constant 300 and calculate the number of large boxes between tip of the QRS complexes. Divide it with that number, we will get the heart rate. If we want to be more accurate, take the constant 1500, calculate the total number of small boxes and divide it with that number, we will get the heart rate. Suppose the rhythm is not regular, then focus on ECG paper and calculate the number of beats for 6 seconds or 10 seconds. Suppose you are considering 6 seconds, it will be 30 large boxes. If you want to consider 10 seconds, it will be 50 large boxes. So once we get the number of beats in that particular time period, multiply with the number which will give us total number of beats in 60 seconds. This will be helpful especially in case of atrial fibrillation if we want to calculate the heart rate. Hope you got the point about heart rate calculation in ECG. If you have not watched our video on standardization of ECG, please go and watch it so that you will understand the basics. Also, we have made ECG reading complete video for beginners. You can utilize that also. And in upcoming videos, we will discuss each of the segments of ECG reading in depth with the reasons for each mechanisms utilized. So I would recommend to share the channel with all of your friends, house surgeons who are working at various departments, so that they will get to know the basics of ECG. Thank you for watching the video.